let us introduce a new cost-effective antidote called Clinicspectrum, which can revitalize your life. Serving more than 600 clinics and 2,000 providers of multiple specialties, Clinicspectrum resolves perennial issues in practice management through an effective hybrid workflow pattern. The hybrid workflow model is created using your existing staff or technology and our back office team members. We have a total team size of 350 employees, out of which more than 50 employees are expert in clinical and office workflow management. These employees possess over 10 years of experience in the areas of billing, practice management, and operation planning. All of these workflow planners are based out of our offices in New Jersey, Houston, and North Carolina. We have a dedicated team of over 300 employees in our back office centers committed to providing excellent knowledge-driven work to resolve practice management obstacles. Let's take a look at the challenges facing doctors and the solutions we provide. Eligibility. Eligibility requirements for patients is thoroughly checked using patients' vital information. This includes what is covered and what is not covered. Who is the PCP? What is the copay? And is the insurance active or not? If the insurance is active, then we check clinic's participating status, calendar year individual and family deductibles, par and non-par benefit covered procedures, annual well checkup coverage, and referral and prior authorization requirements for certain tests and procedures. We could identify a list of patients that are due for follow-ups based on ICD or CPD-based recalls. For example, these lists include patients that are due for well care checkups, colonoscopies, endoscopies, echocardiograms, well care visits, and nuclear tests. For the follow-up appointment of these patients, we will schedule an appointment on your behalf and provide a list to your office. We can do all of this within your software. Scanning and indexing. A single provider-based practice needs 200 to 300 documents scanned on a daily basis. It requires at least 4 to 5 hours of daily staff time. If you are a 10-provider practice, that will be 2,000 to 3,000 documents on a daily basis, or 5 times the size of a normal practice. The cost of indexing could be anywhere between $12 to $16 per hour, or 30 to 45 cents per image. However, we can help you lower that cost by 50% or more. We use indexing rules in order to achieve your guidelines for filing of documents. It allows us to work seamlessly with your EHR under your supervision. Account receivable follow-ups. Between 2009 to 2012, the denials for claims for reasons like inclusive procedures, not meeting medical necessity, required medical documentation, and many other have increased by almost 37%. On an average, 32 to 35 claims out of 100 submitted fall into either documented denials through ERA-EOB and or remain in cyberspace with no response. In addition to this, the patient responsibility portion has gone up from an average of $12 to $30 per claim visit. This results into a double blow to the provider in their cash flow, as it is extremely hard to collect from the patient and it takes a lot of effort to follow up on claims that are denied. In order to collect the 32% denied, no response claims, we have a tremendous knowledge team who can chase after the claims with insurance companies every 6 to 7 weeks until it is paid. Your denials team can focus on doing an initial submission of denied claims, and subsequently we can follow them every 6 to 7 weeks until they are paid. We can save your staff from wasting valuable paid time on follow-ups, as each phone call to the insurance company costs $4 to $5, and we can reduce that cost by 50% or more. We can work on all types of denied claims. No-show rescheduling and appointment reminders. We can call all your patients that did not show up through our automated engine for rescheduling, or have one of our trained live professionals call them for rescheduling. It includes those patients who were scheduled for office visits and tests or procedures who did not show up due to known or unknown circumstances. Each patient that missed an appointment is a loss of $60 to the practice and can also be considered negligence for certain critical patient care requirements. Therefore, rescheduling is of utmost importance. We can work out a customized appointments work plan for practice to remind patients of their appointments, either through text messaging, secured messaging, automated calls, or live representative calls, and many more services. Clinicspectrum is your office genie, always ready to serve you with a smile.